All pressure, blood pressure measurements method we discussed in previous slides were about direct measurement, direct pressure measurement. But in these slides, we want to talk about indirect measurements of blood pressure. Indirect measurement of blood pressure is an attempt to measure intra-arterial pressure non-invasively. Non-invasively means that we want to measure pressure um, from outside the body, from the surface, and we don't want to insert anything into the body, into the vessels. The most standard manual techniques employ either the palpation or the auditory detection of the pulse distal to an occlusive cuff. As you can see, we have various generation of this measurement devices. This is an old device, and this is a newer one. As you can see, we have some mercury-based indirect pressure measurement or measuring based on some gauge. Also, we have some tailor-fitted devices for animals. In this slide, you can see the procedure of a typical indirect blood pressure measuring system, measurement system. As you can see, the sphygmomanometer cuff is inflated by a hand ball to pressure above the systolic level here. Pressure is then slowly released with a small rate, 2 to 3 millimeter Hg per second, and blood flow under the cuff is monitored by a microphone or a stethoscope placed over a downstream artery. Before this point, where the cuff pressure and systolic pressure is as the same, we don't have any flow. Therefore, we cannot hear anything. But after this point, after the situation, we can hear the first Kortokov sound detected by indicated systolic pressure, whereas the transition from muffling to silence brackets diastolic pressure. Also, we can sense the flow and the pulses with some palpation, with palpation here. Also, we can use microphone and auscultatory methods and also palpation methods. And as you can see, we have a sound signal, something like this. The sound will start from here. You can see an increasing in amplitude, and after that, muffling to silence will occur. The auscultatory technique is simple and requires a minimum of equipment, and this is the most important advantage of the system. But this method suffers from some disadvantages. The auscultatory cannot be used in noisy environment, whereas the palpation technique. In Employing the palpation and auscultatory techniques, you should take several measurements because normal respiration and vasomotor waves modulate the normal blood pressure levels. These techniques also suffer from the disadvantage of failing to give accurate pressure for infants and hypotensive patients. The observation differ from observer to another. The observations do not always correspond with intra-arterial pressure because we have some medium tissues such as fat, muscle, bones, and these tissues will affect on the resultant value for the pressure. And a mechanical error might be introduced into the system. For example, mercury leakage, air leakage, and obstruction in the cuff. Hearing acuity of the user must be good for low frequencies from 20 to 300 Hz. Using a occlusive cuff of the correct size is important if the clinician is to obtain accurate results. The pressure applied to the artery wall is assumed to be equal to that of the external cuff. However, the cuff pressure is transmitted via interposted tissue. The failure of auscultation technique for hypotensive patients may be due to low sensitivity of human ear to these low frequency vibrations. In addition to manually detection of cortical sounds, we can use automatic indirect blood pressure measurement systems. And in the next page, in this and the next page, we will consider these automatic indirect measurements. Three of the commonly used automatic indirect blood pressure measurement will be discussed in these pages. Method 1 is using microphone instead of a stethoscope. A rapid inflation about 30 milli Hg higher than systolic pressure, and after that the flow of blood beneath the cuff is stopped by the collapse of the vessel. Reduce cuff pressure slowly, 2 to 3 millimeter Hg per second. The first Kortokov sound is detected by the microphone. The muffling and silent period of the Kortokov sound is detected. The instrument displays the systolic and diastolic pressure. Method 2 is the ultrasonic pressure measurement. The ultrasonic determination will be used for detect the critical points. Transcutaneous Doppler sensor that detects the motion of the blood vessel walls. The reflected signal shifted in frequency is detected by the receiving crystal, and the difference in frequency in the range of 14 to 500 Hz between the transmitted and received signals is proportional to the velocity of the wall motion and blood velocity. As you can see, we have similar cuff here also, and the cuff will be collapse the artery inside the body, and when the path of blood is blocked, we don't have any frequency shift in receiving and transmitted ultrasonic waves, but after opening this region by decreasing the cuff pressure because of moving because of the wall motion and the blood velocity, we have some frequency shift in the received signal in compared to transmitted signal, and using some determined exact equations, we can find the frequency, we can find the velocity based on the shifted frequency. Also, in this box, we talk about the cuff and the pressure. As you can see, a compression cuff is placed over the transmitting and receiving crystal. The opening and closing of the blood vessel and the orifice are detected as the applied cuff pressure is varied. As you can see, this is the cuff pressure, applied cuff pressure, and here is the opening point and here is the closing point, because when the pressure inside the vessel pass the cuff pressure to higher values, it can open the path. But when the pressure is decreased to the lower pressures of the cuff pressure, the path will be closed. And we can find the points and find the opening and closing and find the points that open and close are so close together at this top and at this bottom to find the systolic and diastolic pressures. As the applied pressure is further increased, the time between the opening and closing decreases until they coincide. The reading at the point is the systolic pressure. Conversely, when the pressure in the cuff is reduced, the time between opening and closing increases until the closing signal from one pulse coincides with the opening signal from the next. The reading at this point is the diastolic pressure, which prevails when the vessel is open for the complete pulse. The advantages of this method are: it can be used with infants and hypotensive individuals. It can be used in high noise environment. And a complete reconstruction of the arterial pulse waveform is also possible via the ultrasonic method. But that movements of subject's body cause change in the ultrasonic path between the sensor and the blood vessel. This problem will affect the readings and maybe some wrong values, some inaccurate values may be recorded by the system. Therefore, we should fix the body of the patient and we should fix the structure of our device to focus on that vessel we want to record. Oscillometric pressure measurement is another blood pressure measurements method, but it is a very common method for blood pressure measuring. This is a non-invasive blood pressure technique. Measure the amplitude of oscillations And these oscillations appear in the cuff pressure signal, which are created by expansion of the arterial wall each time blood is forced through the artery. The cuff pressure signal increases in strength in the systolic pressure region, reaching a maximum when the cuff pressure is equal to mean arterial pressure. As the cuff pressure drops below this point, the signal strength decreases proportionally to the cuff air pressure bled rate. Oscillometric pressure measurement is a very common technique in measuring blood pressure, but it suffers from some serious problems. One of the most important problems is detecting the diastolic pressure. There is no clear transition in cuff pressure oscillations to identify diastolic pressure, since arterial wall expansion continues to happen below diastolic pressure while blood is forced through the artery. Thus, oscillometric employ proprietary algorithms to estimate the diastolic pressure. Using the oscillometric method, the mean arterial pressure is the single blood pressure parameter, which is the most robust measurement as compared with systolic and diastolic pressure, because it is measured when the oscillations of cuff pressure reach the greatest amplitude. The property usually allows mean arterial pressure to be measured reliably, even in case of hypotension with vasoconstriction and diminished pulse pressure. In this figure, the procedure of oscillometric pressure measuring has been shown. As you can see, a compression cuff is inflated above the systolic pressure and slowly deflated. Systolic pressure is detected at point 1, where there is a transition from small amplitude oscillation above systolic pressure to increasing cuff pressure amplitude. The cuff pressure oscillations increase to a maximum at point 2 at the mean arterial pressure. And after that, the vibrations amplitude will decreases, and after complete reduction of the applied pressure, applied compression of the cuff, we should be able to find the location 3 to find the diastolic pressure, but because of the extra vibration of the wall of the vessels, we cannot find the exact location of the point 3. Therefore, if they ask us which point, which pressure can be recorded, can be detected exactly by this method, we should answer only the mean pressure can be recorded, can be detected reliably by this method. In this slide, a block diagram of the major components and subsystems of an oscillometric blood pressure monitoring device has been shown. As you can see, we have a blood cuff here, a complete system to inflate, deflate, control, restrict from the overpressure, and also some amplifiers to amplify the signals recorded by this solid state pressure sensor. Also, we need a microcomputer to control, to analyze, to process signals, and also we need a display to show the parameters and to control and monitor better to better monitor the system performance.